Good morning, everyone. So glad to be here with you today. Wherever you find yourself occupying the world today, whatever space and place that is, we are certainly glad that you are here with us today. I'm so honored to be with you, to talk to you today, not only about the significance of what's happening in our world, but how we move from crisis to recovery and make sure the inevitable data that will drive our decision making helps rather than hurts in that process. Racism, as we all know, and by the virtue of that, inequities, seeded our nation a long time ago. Unattended to and unresolved, they had brought us to this moment in time. And COVID-19 is not the reason for this conversation, but it is the reason so many of these inequities have been brought into a particular light today that allows more people, particularly in dominant culture, to actually see them. I like to say that COVID-19, it's our report card, and it's our report card on racial equity. And we, as a nation, are failing. Here's what we know to be true. I mean, from education to the economy, America's policies and systems designed long ago disproportionately left people of color out of higher wage jobs. The result today is more people of color are serving as essential workers during the pandemic. Our nation's most disinvested communities lack access to quality health care, leaving them vulnerable and more likely to die from COVID-19. And people of color make up the majority in 62% of counties with the highest COVID-19 death rates. And Black citizens are more than twice as likely to die from the virus than white citizens. And Latinx Native Americans are 1.5 times more likely to die, period. None of this is coincidence. It is truly by design. America's history of racism was a pre-existing condition for COVID-19. Planning for recovery. This is not simply about recovery in the short term. You think back, I mean, many of us have seen Band-Aids in our lifetime, none of which have actually gotten to the root causes of inequities that we see today. It's about addressing the long-term crisis that is bubbling up in our country and has been for generations. So this morning, I'm going to share with you how we at Chicago Beyond are doing from our place, what we're doing from our place in the world to address those inequities through questioning and questioning power dynamics. To be clear, we're just today going to talk about a simple slice of the work that needs to be done when it comes to inequities in the world. But we all must do what we can. We are all here and we are all in this together. And where else to start but day to day? And day to day, we should be having this conversation around equity and data and decision making. So you see, it's things that we all know. Questions and inquiry drive our understanding of the world. I mean, they ultimately allow us to discover. They allow us to know something more deeply. Questions allow us to connect. They help us make sense of the world around us. So the questions we ask are important. And questioning, the inputs of the questions we ask, can help us get to a more authentic truth. Before diving in, I'd like to share a little bit about my background so you understand how I came to this conversation. So I'm a former educator. I worked in Chicago public schools as a math teacher and eventually became the principal of Finger High School on Chicago's far south side. When I arrived at Finger as the principal, we know principals, I had the power. I made the decisions. As you can probably guess, I relied on data for decision making. I mean, through and through, I relied on data every single day. Finger at the time was all too typical of what people think of inner city schools, with too many young people failing, and not just academically with their grades, but ultimately in their life outcomes. At the start, I took my power to impose a number of rules and regulations to establish order. But looking back, I saw and I can see that all I was doing was bringing my own bias and my own assumptions to this role of the principalship. I had the power as the principal, which led me to the mistake of thinking I had the answers. And this kept me from getting to the root of what was causing many of the challenges in our hallways at Finger High School. After a year and a half of efforts like this, without really moving the needle, truthfully, I had an epiphany of sorts. Because I had the power, this meant I had the power to shift the power. With this in mind, our administration became much more inclusive and included the people who had the real knowledge about our young people and their lives, everyone from folks like the janitor to the baseball coach to student advocates, all those type of people in our process. We broadened the information that came into the system about our kids and shared it with community advisors and providers seeking their input. And today, this is how something like behavioral health systems that started at Finger High School now are implemented across Chicago public schools. This is based off of that example. As we instituted these changes, we learned to ask the right questions. I mean, too often, I find myself, I was guilty of this too, we'd look at a young person who was having an issue and we'd ask, or I'd even ask, what's wrong with you? That was the wrong question. The right question was actually, what happened to you? In many cases, the trauma our kids were subjected to was constant, and it started long before they arrived at the doors of Finger High School. If their behaviors were going to change, the source of those behaviors had to be understood. And once we began to understand that, we had to shift how we showed up at Finger High School as the adults, as the ecosystem that was supposed to wrap itself around our young people. We started to see those numbers shift. The graduation rate, for example, went from 40% to over 80%. Our dropout rate that was once 20% went just down below 2%. Our arrest rates, we had about 300 arrests inside of the building any given year. Those went down to below 10, and we became a hub for restorative justice and peace circles and all things that led to healing for our young people. But it started with a question and the shift in that question. So in 2016, I had the opportunity to take these learnings and apply them on a journey to shift philanthropy. I created Chicago Beyond, and I created it to push the philanthropic space to show up in ways that are rooted in equity and radical truth, and advance our communities and our young people, to upend power dynamics and to question the questions. In order to implement this philosophy, we've tried to gain a deeper understanding of the ways that we, the powerful, those with privilege and resources, et cetera, how we hold power in place, especially as it relates to data and research. And we've concluded that there are 7 inequities that stand in the way of true impact. So I want to show you this visual. Check it out. You can see on your screen, we've got access, information, validity, ownership, value, accountability, and authorship. People in power tend to hold and control these. I mean, just think about it. Today, we have the access. We decide what information is shared. We determine who and what is valid. We decide who owns what. We assign value. We hold the accountability measuring stick. And ultimately, we assign authorship. Earlier this year, our country was still as we were all in quarantine. And in that space of quiet and stillness, it allowed us to really see how poorly our nation was doing on racial equity. It allowed that report card to actually come out and be seen. But long before that moment, in May of 2019, as a matter of fact, Chicago Beyond published our findings from our time in research in our guidebook called Why Am I Always Being Researched? It was based on this premise. If you believe that research drives decision-making, you have to care about how it gets done. Now, I myself, I am not a research expert. I'm a principal by trade and now happen to be in philanthropy. But Chicago Beyond itself, as an organization, believes in research, and we invested millions of dollars, as a matter of fact, when we first started Chicago Beyond. A significant amount of research. I mean, we've been at the table as funders with our nonprofit and research partners. We've invested more than $30 million across community organizations, ideas, and individual leaders here in Chicago that back the fight for youth equity. And by virtue of that, we've also partnered with institutions from the University of Chicago to Berkeley to Drexel, all in the name of gleaning powerful data to drive our investments further. And we have seen, as I'm sure you have too, the power dynamics that exist and manifest themselves. So let me give you a few examples of what I'm sure you've seen and then what we've seen here at Chicago Beyond. So we have seen funders and researchers jump to action when research protocols or timelines are at risk, but remain silent when research does not produce a high quality outcome for the community. Community organizations ask us why oftentimes researchers who have never been to their neighborhoods before starting the project have the power to tell them what works and what doesn't work for their community and young people. We've heard program staff who live and work in their own neighborhoods express concern over what being associated with research means for their own relationship with their community's families. There is a deep-rooted mistrust of research and being researched, and that has created an unease in many neighborhoods across our country. We've seen social workers who have asked us, why are we using inputs and outcomes that are rooted in structural racism to validate their work? They have read between the lines of researchers' questions and recognized the deep disconnect from their lived experience and the inputs of researchers. Why Am I Always Being Researched was designed to help us understand and shift power and recognize unintended bias in research. It is about shifting the way community organizations, researchers, and funders engage in the economy of knowledge and restoring communities as experts. I'll dive into a few examples, which I'm sure many of you will relate to. So we'll talk about one of those 7 inequities that I mentioned earlier. So we'll talk about information. So we're currently funding a study with one of our research partners in the fatherhood space. And one dimension of the evaluation is a measurement of fathers' engagement as it relates to them being in this program. And one action they are measuring is taking your child for a walk. Seems pretty simple. Sounds very simple, as a matter of fact. The question is, how often do you take your child for a walk? Now let's add some context that's not being reflected here when we think about this question. The young fathers that this program serves live in one of the most violent neighborhoods in Chicago. And taking a child for a walk in that particular neighborhood could be very dangerous. Yet the study design penalizes that father, that program, for doing what every father ultimately should do, which is keeping their child safe. Researchers have to understand these many nuances to truly assess the population. There was an assumption here about how they would father in their own environment, given their own resources. And just think about the impact of this misguided question to an evaluation, the program measures, and the dads who actually rely on that program. We'll jump into validity. And this example is actually anchored in power, specifically the power to determine what is valid, whose ideas matter. So last year, actually about 1.5 years or 2 years ago, we co-created the concept of a safe house with Iman, which is the Inner City Muslim Action Network in Chicago. The safe house is designed to provide haven for young men who are in imminent danger and want to make a change in their lives. Iman provides far more than just housing in the form of actual mental health services, job training, use of arts and cultural and community elements to help heal. The concept of the safe house actually didn't come through Chicago Beyond citywide call for funding opportunities, or even through our team or anyone in philanthropy who scours the city for ideas. Instead, that idea came from a young person and that young person's experience. One young man who in fact desperately needed a safe haven from violence and time to breathe. And the realization by myself and my team that place simply did not exist in Chicago. But recognizing that young man's needs were important and they were urgent. And we had to take incessant action to help create a space where that young person can live, where they can breathe. We didn't wait to determine if his need was backed by empirical evidence. His situation was human, and it was happening right now, and we knew we needed to act quickly. If we waited to determine validity or risk, lives could have actually been lost while we waited for decisions to be made in boardrooms or even for evaluations to be completed. The last one I'll talk about today is accountability. This is an example from one of our partners, the Lawndale Christian Legal Center, and they provide holistic legal assistance for young people and emerging adults who get involved with the justice system. And they provide legal support, so things like case management, outreach support type stuff. And case managers connect with young people to services, and then they provide housing, employment counseling, substance abuse treatment, mental health recovery service, and wellness assistance. I mean, a great, great, great organization. Well, we first proposed giving them a little bit over $1 million of an investment. They weren't sure of it. They responded that they weren't sure that they wanted it, in fact. They were skeptical of yet another organization entering their community to exert its power. They feared we would tie too many strings to the money and not be accountable ourselves. When the executive director said that his staff would need to make peace with the evaluation, that is exactly what we did. The Chicago Beyond folks, myself included, went and we sat in a peace circle with the folks at Lawndale Christian Legal Center. And if you know anything about peace circles, they're totally rooted in equity. No one has more or less power in a circle. We were in their space. We were coming into their community. And for LCLC, it was them being accountable to their neighborhood. And for us, it was recognizing our accountability to them and to their concerns. Together, our ultimate accountability was to the young people that they were serving. This shared accountability set the stage to create an evaluation committee, which was made up of ourselves, Chicago Beyond as funders, the research team, the Lawndale Christian Legal Center attorneys, the case managers, and the outreach team members. That team met weekly and worked closely together on every aspect of that study, including the design and the outcomes. I mean, it truly shifted the power dynamic and leveled the playing field for all of us in that instance. Now, how does all this relate to that report card on racial equity that I mentioned earlier? If we want to avoid perpetuating the same problems and structural biases that have persisted in communities of color for generations, and in which COVID-19 is now presenting to us in full color, we need to change our orientation in how we produce, analyze, use, and assess the validity of evidence. And if we do not focus on equity, we are guaranteed to generate more inequity. This is where the questioning comes in, for example. So who and what is being counted in the data around COVID-19? When it comes to who is being counted, a lot of people are invisibilized, if you will, by data. I mean, take, for example, incarcerated people. They are excluded from census data. So where many people have been incarcerated, many people are not counted in wealth data or health data. This means a failure to reach or serve people that can be invisible in data. And efforts that benefit everyone, according to the data, could leave this population of people out and leave them behind. Also, think about those who are no longer seeking employment are excluded from employment data, including those who have concluded it is futile to look for a job in these times. Again, this means a failure to reach or serve people. It can allow them to be invisible. And efforts that benefit everyone who wants employment could leave this population behind. Health data, including COVID-19 positive test rates, are an artifact of where health access and testing is actually available. Another question. What are we asking of those we wish to support? Requiring evidence as a condition for funding means more resources go to those who, I mean, generally speaking, already have more resources. It takes resources to produce evidence. Lastly, at least traditional evidence. Lastly, who is benefiting from our research? We often don't ask for or produce data on who is benefited least and who is benefited the most. Averages hide inequity. As a former educator, and as I'm sure many of you know, your average test scores can improve while inequity actually gets worse. I've seen it firsthand. Individual data are the most of the data set systems produce, making it easy to use evidence to put the onus on the individual, and hard to use existing evidence to shed light on systemic failure. Feeding into deficit narratives based on how data sets up what normal is and what falls short only exacerbates the inequities around us. We're talking about questioning the questions. From my vantage point, it's truly about noticing and then speaking up. We are in the middle of a justice revolution, and none of us are exempt. I'm not asking you to print off our 7 inequities and post them to your computer or virtual workspace and use them as a checklist on how you're doing on racial equity. Although I have heard there are a lot of people who are printing them out and referring to them often. But I'm asking you to notice these things in your work, whether you're a nonprofit seeking your data dream, or you're a funder funding the data dream, or you're a researcher designing that data dream project. We will only get out of this current crisis by focusing and explicitly focusing on equity. We are all students in this game of life, and you can bet these report cards on racial equity will continue. The question is, when the next one comes across your desk, how will you measure up? Thank you.
Liz, that was excellent. Thank you so much for sharing that with us. If you don't mind, we'd like to turn now to some of the questions that have been submitted in advance, and then we were inviting people to add their questions to the chat as we go. The first question up is from Ian Bautista. Ian is a board member of Data You Can Use and currently at the Greater Milwaukee Foundation, but was also a leader of a neighborhood initiative here. And he asks, in your work on becoming an anti-racist, you talk about being racially literate. We've been talking about literacy in the age of data. Can you talk about the intersections and how these efforts might meet to avoid perpetuating these same systemic problems?
That's a great question. We think about being racially literate and also literacy in the age of data. And in my vantage point, it's not that they might meet, it's that they are inherently intertwined. You will not, and at least from my perspective, you won't run into these issues separate from one another. At their core, I really believe they're baked into everything. It's baked into every one of the systemic problems that we're talking about. It's rooted in racism, bias, and in power. And it's essentially why we wrote Why Am I Always Being Researched? I mean, it was designed to help call out those inequities and provide tools to question how they show up specifically in the nonprofit, research, and other philanthropic sectors.
Thank you. That's really perfect, that those two things go hand in hand. Mm-hmm. We have another question here from Aaron Chapinski. Aaron is in the mayor's office at the city, and he's been a real advocate for open data for Milwaukee. And he asks, your work has specific suggestions for community organizations, for researchers, and for funders. But could you talk about how local government can be involved in producing and analyzing information to reduce perpetuating structural bias? Sorry.
That's a great question from Aaron. I love that. I think for me, it's focusing in on the idea of access, as we talk about in Why Am I Always Being Researched. And it's just that the people being researched should be at the decision-making table. And in that respect, it is not complicated. It is truly a matter of access and making sure that there is equity and voice at that table, at the decision-making table. I was recently asked what we lose when Black women's voices were held back. I was talking at another panel last week. And regardless if it's a Black woman, if it's Latinx men, if it's Asian women, whomever, the answer is that we as a society will never be as impactful or as innovative as we possibly can be when we have voices that are left out of the mix. More diverse voices, whether it's, racially, ethnically, regards to gender, where people live. I mean, all those things, from at least from my vantage point, adds to innovation and ultimately getting us to the best solutions. And when it comes to research, hands down, the most important voices involved are those who are actually impacted by the research. I think a second thing to consider is authorship. How are those impacted by local research driven by government actually a part of the authorship process? So information gleaned from the community should be credited to the community. Lastly, this is not about stepping away from how things have always been done to get to better and more equitable results. This is about stepping away from how things have always been done to get to better and more equitable results. In your case, that might mean even getting a bigger table and really adding more seats.
Great answer, Liz. Thank you. We have another question here from Susan Lloyd from Lloyd Consulting. And I want to first give a nod of thanks to Susan for making the connection with you so that we could have you here for day-to-day this year. Thanks, Susan. Her question is, you have a suggestion to funders about supporting the full costs of community research and recognizing the costs to community organizations and participants. Could you give an example of how that's being done?
So I think a living example is the one that I mentioned when I was chatting with the group earlier, and it's really Lawndale Christian Legal Center. We truly built that research study together. And I want to acknowledge that it took longer, right? There was more time. It's easy to have a small group of people at the table coming up with questions and just, pressing go on the research study. But to really involve community members, residents, the funders, which at that time and still is us, at the table required a little bit more patience, and it took longer. It cost more. I don't mean dollars. I mean, but this truly the value of people's time and everyone's part to really invest in that. We had to enter into the study truly from a place of mutual understanding, which it takes a while to build that. But that's been so much more value than hitting go superficially, which I think oftentimes is what we can do. And there are unintended consequences of that when it comes to the results of what we're trying to produce. Another way to explain this, I would say, is our partnership model at Chicago Beyond. We are fundamentally designed to walk in lockstep with those we invest in. I think oftentimes in philanthropy, and I'm new to philanthropy in this last 4 years, what I've noticed is there is this inherent power dynamic in the very way that nonprofits and funders relate to one another. And it's somehow the funders are the brains and the communities down here, they're the brawn, and these people tell these people what to do. And I just don't believe in that. I don't think it's just, I don't think it's rooted in equity, and I don't think it leads us to the best results. It is equal. It is a true partnership. Each entity, each party brings its own knowledge base and adds value to the work and should function really in true partnership. And that's what we do. And I acknowledge not everyone can show up in the same ways as we show up. But funders can root themselves in the 7 inequities and continuously work against having those inequities show up in the work that they do every single day.
There's actually another question here about partnership, really getting to that question. And this one comes from Damian Smith. Damian is a youth program manager at Safe and Sound, and they were one of the partners in the Amani project we talked about earlier. Damian's here to actually ask his question. Damian?
All right. So I know you were a former principal and that your organization works for youth equity. Can you give some advice on how community organizations can partner with you to produce and analyze information to reduce bias?
Yeah, so I think it's actually more of, it's, obviously people can reach out to Chicago Beyond at chicagobeyond.org and get connected into the work that we are doing, that stuff that involves, projects that involve research and, stuff that doesn't involve research. You can, learn more about us there. But I think it's a bigger push on both sides of this philanthropic equation, and there's actually, I guess, three sides to it. But it's a push really on the funder side, the researcher side, and the nonprofit side. And we talk about this a lot in Why Am I Always Being Researched, and it is just this: is that we must each hold ourselves accountable wherever we sit in that equation. We must each hold ourselves accountable and hold others accountable too. I think part of us not producing, research that is biased or research that doesn't lead us to the ultimate results is holding ourselves and our standard of truth. And so for community organizations, for example, I know as a principal, there were research studies that happened at my school, and I'm not proud of this, but this is the truth. Like I needed the resources. I needed the resources that the research would bring. So for example, an extra counselor, when they were testing to see, particular counseling methodology worked. And so as a principal, there were too many times I felt that I, agreed to a research study and didn't really fully understand the questions or didn't really fully understand what it exactly was happening, what was being tested, and what would be gleaned from that. And I think it has unintended, again, consequences. And so I would say for community organizations, it's important to be informed, to fully understand, what is actually at stake here, and being a part of that research process in real ways, and actually demanding to be a part of that research process in real ways, and leaning into the uncomfortability of that. I mean, I even as a funder, I sit at these tables and it can be uncomfortable, just sitting with researchers and all the terms and then, 9 million things they bring to the table. But leaning into that and asking the questions when you understand something. And I think that same level of accountability holds true for researchers, and same level of accountability holds true for funders, each from their own vantage point, obviously, because they come from a different space in the work, but to really lean in to ensure that ultimately that the needs that are being served are the needs of our young people and of our communities. Thanks so much, everyone. So glad we could be together today. Unfortunately, that's all the time we have for questions. But you can learn more about our work at chicagobeyond.org. And I'm going to turn it back over to Amy. So Amy, take it away.